Okay, so we will be discussing the intracanal medicaments. The intracanal medicaments are essential for killing the bacteria present in the root canal, an agent used as an adjunct to cleaning and shaping for the prevention of any further bacterial growth in the root canal. The functions involve destroy microorganisms and prevent degrowth, reduce interappointment pain. It is useful in treating apical periodontitis as a result of over-instrumentation. It is useful in weeping canals where constant clear or reddish exudate is present and large apical radiolucence is there. Inhibits root resorption. The ideal requirements: it should be effective germicide and fungicide material, it should be non-irritating to periapical tissues, should remain stable in the solution, should have prolonged antimicrobial effect, it should be active in presence of blood, serum, and protein derivatives of tissues, it should have low surface tension and easily diffusable, should not interfere with repair of the periapical tissues, should not stain the tooth structure, should be capable of inactivation in culture medium, should not induce cell-mediated immune response, it should be easy to handle, mix, place and remove, and it should be inexpensive. Now the classification, according to the Grossman, essential oils involve eugenol, phenolic compounds, phenol, parachlorophenol, camphorated parachlorophenol, cresol, formocresol, creosote, cristatin, and crisanol. And third one is nitrogen. Salt of heavy metals, metaphen, merthiolate, mercurofen. Halogen, sodium hypochlorite, iodides, chlorhexidine. Quaternary ammonium compounds involves 9-aminosidine. Fatty acids involves propionic acid, caproic acid, and caprylic acid. Sorry, sulfonamides. According to DCNA, Dental Clinics of North America, phenolics, eugenol, CMCP, camphor monochlorophenol, PCP, parachlorophenol, crisatin, creosote, beechwood, and thymol. Aldehydes involves formocresol, glutaraldehyde. Halides involve sodium hypochlorite, iodine, and steroids, calcium hydroxide, antibiotics, and combinations. Eugenol. Eugenol is the chemical essence of oil of clove and is somewhat related to phenol. It is slightly more irritating than oil of clove and is both an antiseptic and then anodyne. It's a pale yellow liquid which becomes dark with age. It has a clove-like odor and from which it is derived and has slightly anesthetic as well as antiseptic properties. Phenol, oldest compound for controlling microorganisms, white crystalline substance and has a characteristic odor derived from coal tar, protoplasmic poison and produces necrosis of the soft tissues by its ability to penetrate and disrupt the cell wall of the bacteria and subsequently the protoplasm, highly effective in 1 to 2% concentration. Phenols, camphorated phenol and camphorated paramonochlorophenol, Volkov in 1891. So, camphorated phenols contains 30% phenol, 60% camphor, 10% ethyl alcohol. It is least toxic, excellent antimicrobial, relieves pain. Mechanism: slow release of phenol. Camphor serves as a vehicle and diluent. When it is compared to camphorated paramonochlorophenol, So it contains 35% monochlorophenol, 65% camphor. Antimicrobial effect is good, highly toxic to tissues, used in the form of vapor forming ICM. The vapor passed through the apical foramen. Cresol. Cresol is tricresol. This mixture of ortho, meta, and para isomeric cresol is obtained from coal tar and may contain a trace of phenol. It is colorless or pinkish liquid with a phenolic odor. It is approximately 3 times more effective as a disinfectant than phenol. Creosote, it is clear, yellowish, oily liquid and has a sharp, pungent, aromatic odor. It is a better disinfectant than phenol and is less toxic and irritating. In dentistry, only the beechwood variety of creosote should be used. Quercetin, mm, metacrycyl acetate or quercetin is the acetic acid ester of metacresol. Its antibacterial effect is enhanced because of its low surface tension and its effect is prolonged by its low vapor pressure. Crisanol, it is a combination of quercetin 1 part, p-chlorophenol 1 part, and camphor 2 parts. It is slightly more effective as an antiseptic than quercetin and slightly less irritating than chlorophenol. Nitrogen, claimed to be both an intracanal medicament and sealer. It has a high degree of antimicrobial activity but is irritating and toxic. Nitrogen Nitrogen has permanent disinfectant action and unusual antiseptic properties. Antibacterial effect of nitrogen is short-lived, being dissipated in about a week or 10 days. Formoprazole, Buckley in 1905, given by this. It is a clear, slightly reddish liquid with a distinctive odor. The proportion of formalin and cresol varies from 1:2 to 1:1%. It is a mixture of three isomers. The formula is formaldehyde 19%, cresol 35%, glycerine and water. Heavy metal salts, protoplasmic poisons. They precipitate albumin and produce new compounds which stain tooth structure. Once ammoniated silver nitrate was used for disinfection of the root canals, but it stained the tooth structure. Organic mercurial salts such as metafin, methriolate, mercurofin, etc., are strong disinfectants which have a lesser tendency to precipitate albumin. Halogens. Disinfectant action of the halogens is inversely proportional to their atomic weights. Chlorine, having the lowest atomic weight, has the greatest disinfectant action of the member of this group. Chlorine is released from sodium hypochlorite and from chloramines. Sodium hypochlorite. It is used clinically in concentration from zero point 0.5 to 5.25%. Necrotic tissue and debris are dissolved by sodium hypochlorite, a property exploited in biomechanical cleansing of the root canals. Iodine. Iodine has been used for many years and is known for its mild effect on living tissues. The two most common preparations used in dentistry are iodine tincture 5% in alcohol and iodine potassium iodide, iodine 2%, potassium iodide 4% and distilled water 94%. The former solution is used for the disinfection of endodontic surgical fields and the latter for intracanal medication. Calcium hydroxide. Hermann introduced calcium hydroxide into dentistry in 1920. It is a highly alkaline substance with a pH of approximately 12.5. It has an antibacterial properties and has the ability to induce repair and stimulate hard tissue formation. Diacal life relief cavity. It has highest effect on endotoxin, that is inhibits lipopolysaccharides, repair of the periapical tissues after root canal treatment of the teeth with periapical lesion was better with calcium hydroxide used as an intracanal medicament or dressing before obturation by Mario Tanamar. In case of apical periodontitis, root canal dressing with calcium hydroxide produced definite signs of healing after only few days. Classification: calcium hydroxide paste can be classified as setting and non-setting. The former is used for lining or sublining of cavities or as a root sealer, while the latter is used for dressing the root canals. Setting material available normally as two-phase system. Non-setting material calcium hydroxide in paste form with various vehicles or as a powder. Setting calcium hydroxide materials. Antibacterial effect of the setting calcium hydroxide material, Fisher and Shortall, 1984. Strong effect, Diacal original formula, Riocap and Procal. Then Diacal new formula, Life Renewed Riolite. And the third one, MPC, mild effect and no effect. Okay. So MPC Hydrex and Calmer VI. 7. Calmer 7. Non-setting calcium hydroxide material and their vehicle. Material में annular calcium hydroxide, vehicle water, pulpident methyl cellulose, hypocal methyl cellulose, and biogen methyl cellulose. Setting mechanism: the two-phase system, which is based on the reaction between calcium and zinc ions and a salicylate chelating agent, and is accelerated by the presence of water. The single-phase system, which utilizes the polymerization of a dimethacrylate by means of light. Now the composition: paste 1 or catalyst. Component: calcium hydroxide 50%, zinc oxide 0.5%, zinc stearate 0.5%, ethyl toluene, sulfonamide 39.5%. Function of calcium hydroxide: primary reactive ingredients and function: zinc stearate, accelerator, ethyl toluene, oily compound, act as a carrier. Base 2 or a base: glycol salicylate 40%. Its function is primary reactive ingredient: titanium dioxide, calcium sulfate, calcium tungstate. Their function are inert fillers, pigments, and radiopacifiers. Now the physical properties. Thermal properties: calcium hydroxide bases may provide thermal insulation to the pulp if used in sufficiently thick layers. The pH of these materials is 9.2 to 11.7. This pH is not suitable for survival of the microorganisms. It can neutralize the free phosphoric acid of a phosphate cement. A thickness of 0.25 mm is sufficient to serve as an effective barrier against passage of acids. Strength: the quick setting material gains strength rapidly but are still very weak and undergo large plastic deformation at the time of condensation of amalgam, approximately 7 minutes from the time of mixing. At 7 minutes, the compressive strength is about 6 MPa and tensile strength is 1.5 MPa. At 1 hour, the values are 10 MPa and 1.5 MPa, and at 24 hours, 14 to 20 MPa and 1.7 to 2 MPa. After 24 hours, it is 6 to 10 mn per meter square, and tensile strength is 1 to 2 mn per meter square. Setting time: the mixed material have very low viscosity and setting can be slow for some products. Moisture Moisture has dramatic effect on rate of setting. Setting time vary from 2.5 to 5.5 minutes. Chemical characteristics of calcium hydroxide. Calcium hydroxide is a white odorless powder with formula CaOH2, molecular weight of 74.08. It has low solubility in water, about 1.2 gram per liter at 25 degrees centigrade, which decreases as the temperature rises. It is insoluble in alcohol. Low solubility of calcium hydroxide is a good clinical characteristic as a long period is necessary before it becomes soluble in tissue fluid when in direct contact with vital tissues. It is chemically classified as strong base. Its main action come from the ionic dissociation of calcium and hydroxyl ions, and their effect on vital tissues and bacteria generates the induction of hard tissue deposition and the antibacterial effect. According to Rahman et al., calcium hydroxide dissociates into calcium and hydrogen ions when in contact with the aqueous fluids. Calcium ions plays an important role in the initiation of the remineralization process. Hydroxyl ions are believed to be responsible for the highly alkaline nature of the calcium hydroxide, which is bactericidal. Now, the mode of therapeutic action, denture bridge formation and antimicrobial action. Mechanism of calcium hydroxide. Calcium hydroxide is divided into calcium and hydroxyl ions. Calcium ions stimulates deposition of the calcium phosphate and constricts the blood vessels, while hydroxyl ions shows the bactericidal action, which in turn creates the sterile zone, and also the hydroxyl ion increases the pH, which hydrolyzes the phosphodiesters, which release of the PO4, which all these combinedly form favors mineralization. Now the calcium hydroxide, due to high pH, shows antibacterial effect, encourages repair, neutralizes the lactic acid of osteoclast, stimulates alkaline phosphatase, and induces the calcification. While direct effects denatures the protein in the root canals, activates calcium-dependent ATPase reaction, and accelerates healing by diffusing through dentinal tubules. These all create the dentin bridge formation. Mechanism of antimicrobial action. Most of the endodontic pathogens are unable to survive in the highly alkaline environment provided by the calcium hydroxide. Since the pH of calcium hydroxide is about 12.5, several bacterial species commonly found in root canals are eliminated after a short period when in direct contact with calcium hydroxide. Antimicrobial activity of calcium hydroxide is related to the release of hydroxyl ions in an aqueous environment. Hydroxyl ions are highly oxidant, free radicals that show extreme reactivity, reacting with the several biomolecules. This reactivity is high and indiscriminate, so this free radical rarely diffuses away from the sites of generation. Their lethal effects on bacterial cells are probably due to following mechanisms: damage to the bacterial cytoplasmic membrane, protein denaturation, or damage to the DNA. Now, the advantages of calcium hydroxide and disadvantages of the calcium hydroxide we will be discussing. Advantages: initially, it has an bactericidal effect to bacteriostatic effect, promotes healing and repair. High pH stimulates fibroblasts and it neutralizes low pH of the acids. Disadvantages of the calcium hydroxide include that it does not exclusively stimulate sclerotic dentin deposition, does not exclusively stimulate reparative dentin deposition, does not exclusively stimulate dentin bridge formation. Advantages of calcium hydroxide: it stimulates enzyme system, drops in rate of internal resorption, most ideal endo-intracanal medication, inexpensive and easy to use, Particles may obturate upon tubules. Ideal temporary luting cement. Again, disadvantages does not exclusively stimulate apexification associated with primary tooth resorption, may dissolve after 1 year with cavosurface microleakage, degrades upon tooth flexure, interfacial failure upon amalgam condensation. Unlike eugenol, calcium hydroxide is not a pulpal anodyne. Now, the uses of calcium hydroxide, it is used in lining the cavities, used as indirect pulp capping agent, direct pulp capping agent in pulpotomy, dressing of the root canals, long-term temporary dressings, treatment of infected root canals and periapical lesions, apical closure, prevention of the root resorption, repair of iatrogenic perforations, treatment of horizontal root fracture, and and also as a root canal sealer. Now we come to limitations of the calcium hydroxide. Residual calcium hydroxide can shorten the setting time of zinc oxide eugenol based endodontic sealers. It is not totally effective against E. faecalis and Candida albicans. Dentine can inactivate the antibacterial activity of the calcium hydroxide. Based on the current best available evidences, calcium hydroxide has limited effectiveness in eliminating bacteria from human root canals. Polyantibiotic paste, PBCN by Grossman, PBSC and PBSCN by Grossman. Grossman mentioned about the utilization of polyantibiotic paste as an intracanal medicament in weeping canals or where there was a continuous seepage from the pulp space. He had mentioned about PBSC containing penicillin, bacitracin, streptomycin with the caprolate sodium as a vehicle. PBSCN combination was also advocated with N-neomycin as an antifungal agent. Mechanism of action of penicillin. Penicillin binding protein. Okay, so mechanism of action of penicillin. The penicillin binding protein. Here, the penicillin action is helps in the inhibition of the cell wall synthesis. Thus, bacterial cell death occurs. Lidermix paste. It is a corticosteroid antibiotic paste, non-setting water-soluble paste used as a root canal medicament or as a direct or indirect pulp capping agent. At first 24 hours, 30% of the corticosteroid is released. At the end of the 14 weeks, the remaining 70% is being released. In case of the replanted teeth, immediate intracanal placement of the Ladamix may inhibit root resorption. Ladamix paste, triamcinolone and demeclocycline. Triamcinolone it has anti-inflammatory action, concentration of 1%, inhibits clastic cells, that is osteoclast, cementoclast, and dentinoclast. The demeclocycline has antimicrobial action, concentration of 3.21%. This is the picture depicting how it is placed. So, when the pulp is inflamed, it can be placed on the exposed pulp and temporary dressing can be given. Or also when pulp is extirpated completely, the Ledemic paste can be placed and followed by the temporary dressing. After 3 to 6 days of patient returns for commencement of the root canal treatment. So antibiotics, sulfonamides are used as medicaments by mixing distilled water or moistened paper points into the jar containing the powder, indicating an acute periapical abscess, disadvantage yellow discoloration. The antibiotics containing agents used in endodontics, hair, antibiotic compound, redomix, pulpomyxin, then odontopaste, streptomycin forte, biopure MTAD, and tetracycline. The antibiotics present are dimethylchlorotetracycline, polymyxin B sulfate, then clindamycin, neomycin, polymyxin B sulfate, doxycycline hyclate, and doxycycline. Then effectiveness against bacteria shows in the letter mix gram positive and gram negative in pulpomyxin in gram negative except the protease group. Then for aerobic and some anaerobic bacteria, odontopase for gram positive and some gram negative. Then septomycin forte for gram negative and some gram positive. Then in biopure MTAD for both gram positive and negative, and tetracline for both gram positive and negative. Usage of these ledomix for as pulp capping agent, intracanal medicament, then pulpomyxin as the pulp capping agent, odontopase as an intracanal medicament, septomycin forte for as an intracanal medicament, biopure MTAD as an irrigant, and tetracline as an irrigant. Further, the antibiotic compounds tetracycline impregnated gutta perca. It has 10% tetracycline used effective for both gram positive and negative. It is used as an intracanal medicament. Final obturating material, then sustained release delivery gutta perca points containing metronidazole. It has metronidazole. It is effective against gram positive anaerobic bacteria and gram negative anaerobic bacteria. It is used as an intracanal medicament and also as a final obturating material. Then controlled release delivery gutta perca points containing metronidazole compounds. It has metronidazole. It is uh, it is effective against anaerobic gram positive anaerobic bacteria and gram negative anaerobic bacteria. Intercanal medicament, final obturating material. It is used as an intercanal medicament and final obturating material. Also, the triple antibiotic paste TAP. It has metronidazole, ciprofloxacin, and minocycline. It is act, it shows its effect against gram positive anaerobic bacteria, gram negative anaerobic bacteria, then uh, that is for metronidazole, and for ciprofloxacin, it works against gram positive and gram negative. Also, the minocycline against gram positive and gram negative bacteria. It is used as canal disinfection for pulp revascularization. Then antibiotic containing scaffolds, metronidazole or ciprofloxacin. It is the metronidazole or ciprofloxacin are active against anaerobic gram positive and gram negative bacteria, and ciprofloxacin for gram positive and gram negative bacteria. It is used as canal disinfection for pulp revascularization. So note here that intracanal antibiotic paste may cause bacterial resistance. Mixing erythromycin with calcium hydroxide improves the effectiveness against E. faecalis as compared to calcium hydroxide alone. Corticosteroid antibiotic combination are anti-inflammatory agents that may decrease post-operative pain in certain situations. Example: irreversible pulpitis, acute apical periodontitis. Corticosteroid may be ineffective, particularly with the greater pain levels. Corticosteroid antibiotic combinations are useful in treating apical periodontitis, occurring either as a pre-treatment symptom or as a result of over-instrumentation. Mode of application: there are two methods. first one is the medicament can be placed on a cotton pellet and placed in the pulp chamber. The second one is the root canal can be flooded with the prepared medicament. Recent advances in the intracanal medicaments and techniques, triple antibiotic phase. Due to complexity of the root canal infections, the use of the single antibiotic may not result in effective disinfection of the root canal system. The combination that appears to be the most promising consists of metronidazole, ciprofloxacin, and minocycline. Sato et al. Evaluated the potential of this mixture to kill bacteria in the deep layers of the root canal in dentine. The triple antibiotic paste ratio 1 is to 3 is to 3 by weight. So that is ciprofloxacin 1 part, metronidazole 3 parts, and minocycline 3 parts. 1 is to 3 is to 3. CMM. Okay. So the ciprofloxacin has synthetic chloraquinolone and has an bactericidal mode of action. Metronidazole, nitromidazole compound that exhibits a broad spectrum of activity against protozoa and anaerobic bacteria. Minocycline, semi-synthetic derivative of tetracycline with a similar spectrum of activity. So the triple antibiotic phase, 3 mixed phase, ciprofloxacin 200 milligrams, metronidazole 500 milligrams, and minocycline 100 milligrams. The drugs are powdered and mixed. According to Hoshino et al., ratio is 1 is to 1 is to 1. Carrier MP ratio 1 is to 1. Macrogol ointment, propylene glycol. According to Takushi J et al., ratio is 1 is to 3 is to 3 and add either macrogol, propylene glycol or canalcy. Medicated Gattapachas. There are new Gattapacha points in the market that contain calcium hydroxide in a 50% to 51% concentration instead zinc oxide, which makes calcium hydroxide placement and removal easy. Bioactive glass. Okay, so Hanich in 1969 uh, coined it. Bioglass 45 S5, 45 weight percent S. It reacts with aqueous solution and produces a carbonated apatite layer. BAG can be bioactive glass can be the material of choice for pulp capping and periapical bone healing because it is biocompatible and has antibacterial properties. BAG produces less inflammation, dentine bridge formation, and no internal resorption, necrosis or abscess compared to calcium hydroxide. PAD, photoactivated disinfection. PAD utilizes photoactive agent toluene chloride. The activation of the photosensitizer molecule by red laser emitting radiation of the wavelength 635 nanometers. The light is directed to the tip of a small flexible optical fiber that is inserted into the root canal. The maximum power setting of 100 nano NW ensures that the unit does not generate sufficient heat to harm the adjacent tissue. Photoactivated disinfection PAD, showing some pictures. Endox. The endox endodontic system has been reported to sterilize the root canal by emitting high frequency electrical impulses. Sterilization occurs as a result of the fulguration. Claims it is able to eliminate both pulp and bacteria from the entire root canal system. Chlorhexidine digluconate. Chlorhexidine digluconate has been recommended both as a root canal irrigant and an intracanal medicament. As a medicament, it can be used as a 2% chlorhexidine gel mixture of chlorhexidine and calcium hydroxide. A study was conducted by Jose F. Siqueira et al. Regarding the elimination of the Candida albicans infection of the radicular dentine by intracanal medicaments. Chlorhexidine mixed with the zinc oxide was highly effective in killing Candida albicans within the dentine. Intracanal medicaments from nature. Natural and herbal products have been used in medicine and dentistry since time unknown. Use of the plant products in the medicine is known as phytomedicine or phytotherapy. Since chemical and synthetic products are expensive and cause cytotoxic reactions and are not very efficient in elimination of the bacteria, herbal products are used. Propolis. Propolis is prepared from the resin collected by bees from trees of poplars, conifers, and flowers of genera Chlorsia. Propolis is a good antimicrobial and anti-inflammatory agent which can serve as a better intracanal irrigant and intracanal medicament. A comparative evaluation on the microbial efficacy of propolis, sodium hypochlorite, and saline when used as an intracanal irrigant indicated that the propolis has antimicrobial activity equal to that of the sodium hypochlorite. Propolis can be used as a short-term intracanal medication in case of pulp and periapical inflammatory processes. Mild periapical inflammation has been noticed after exposure to the propolis paste. To evaluate in vivo the antimicrobial and inflammatory irritant potential of the propolis against mixed endodontic aerobic and anaerobic bacteria, propolis and commonly used intracanal irrigant. Then comes the curcumin. It is the main yellow bioactive component of turmeric, has been shown to have a wide spectrum of biological actions, including antimicrobial, anti-inflammatory, and antioxidant activities. A study showed that curcumin was able to demonstrate complete eradication of E. faecalis. Another study showed that there was a gradual decrease in the antibacterial activity of curcumin at 3 and 7 days, which may be due to the buffering ability of the dentine. Curcumin does not affect the microhardness of the root and root dentine and is potential intracanal medicament. Cassavia sylvestris. It is shown to be an alternative to intracanal medicaments as the alcohol extract of C. sylvestris constitutes a rich source of phospholipase A2 inhibitors, potential anti-inflammatory agents. Green tea. Green tea, the polyphenols found in green tea have antimicrobial, antioxidant, anti-cardiogenic, anti-inflammatory properties. Green tea has antibacterial property against E. faecalis is planktonic cell. E. faecalis planktonic cell. Articum lapa. This plant is popular all over the world for its therapeutic applications. It is found to have antimicrobial actions against microorganisms causing endodontic infections. It is potential intracanal medicament. Articum lapa. Lemon solution. Lemon solution is a rich source of citric acid. Fresh lemon solution can be used as an intracanal medicament. It is effective against E. faecalis. Nisin. Nisin is a naturally occurring antimicrobial peptide produced by Streptococcus lactis subspecies lactis. It has antimicrobial activity against a wide range of bacteria and their spores. Studies show that it is effective in elimination of E. faecalis from root canal and is more effective than calcium hydroxide. So we complete with this. Thank you.